Member for Bass.
Thank you, Mr Deputy Speaker. As we've heard, each year in Australia over 1,500 women will be diagnosed with ovarian cancer. Australia has made great progress towards improving cancer outcomes, but for ovarian cancer there is still much work to do. The month of February is Ovarian Cancer Awareness Month, and in the lead up to Teal Day this Wednesday, the 26th of February, it is important for us to do what we can to help raise awareness of the disease, its symptoms and what the future looks like for the treatment of some 4,000 women living with ovarian cancer. As we've heard, a significant challenge in the early detection of ovarian cancer is the fact that there is no early detection test available, and symptoms can be hard to spot. Some common symptoms are increased abdominal size or persistent abdominal bloating, abdominal or pelvic pain, feeling full after eating a small amount and needing to urinate often or urgently. Women often put any ailment down to being overworked and overtired, but these types of symptoms are persistent, or if you think that something isn't right, I urge you to make an appointment to visit your GP and always seek a second opinion. Currently, the 5-year survival rate for women diagnosed with ovarian cancer is just 46%. This is due in part to a lack of early detection test and clear early symptoms, leading to a later diagnosis when survival outcomes are poor. Research remains our best hope of defeating ovarian cancer and of developing more effective treatments that will prevent or control the condition. Since 2013, the government has invested over $43 million for ovarian cancer research through the National Health and Medical Research Council, and is also committed to supporting life-saving medical research through the Medical Research Future Fund. Last year, the government also committed $1.6 million to Ovarian Cancer Australia for the Ovarian Cancer Case Management Pilot. This will trial the delivery of a psychosocial support case management model using telehealth to support ovarian cancer patients and their families, with a focus on women living in rural, regional and remote Australia. In my own community, I asked my friend Caroline Brown if I could share her mother's story. Annette passed away recently after a prolonged battle with ovarian cancer, but not before doing what she could to raise money and awareness of the disease. Behind every number is a real person who means so much to those who know and love them, and I would like Caroline's own words to do the talking here. My mum, Annette Bain, was diagnosed in 2010 with stage 4 ovarian cancer after multiple trips to the doctor over 6 months to find out why she was unwell. Once she had her diagnosis, there were surgeries to remove tumours and multiple rounds of chemotherapy and radiation treatments. Throughout her battles, Mum's unbelievable strength shone through, and when she was feeling well enough, her mind turned to learning as much as she could about the disease, the ways that she could educate other women, and to help raise funds to find a method of early detection and hopefully a cure. Ovarian cancer is often called a silent killer due to the symptoms being so vague, and once detected it is usually in later stages. Mum was instrumental in holding multiple afternoon Teal fundraising events during Ovarian Cancer Awareness Month and encouraged me to take part in many Frocktober events, despite not being a great fan at that time of dresses. She encouraged awareness for the public in Launceston through numerous interviews with the Examiner and on local radio. She became one of the state ambassadors for Ovarian Cancer Australia, and through this position spoke with many groups including Rotary and Seroptimists, as well as taking part in the ovarian cancer awareness events held at the Launceston Black Pepper store. We have so many to thank for giving us extra time with Mum: the Holman Clinic at the LGH, Dr Penny Blomfield, Dr Jeremy Power and their teams, and finally to the amazing palliative care team at the Melwood unit, especially Dr Jen Lim. Mum fought her battle like she lived her life, quietly, courageously, with dignity and grace. Caroline continues, "There are many women still battling this disease, and sadly many more will be diagnosed. Thanks to ambassadors like Kristen Larson, who lost her battle at 27, Jill Emberson, who lost her battle 4 years after being diagnosed, and my mum, who lost her battle in December last year, more people are now aware of the disease, getting them self-checked if they have any symptoms, and helping to raise much-needed funds."